is the gathering of topmost health practitioners in Nigeria, gathered to rub minds and provide solutions to the menace rocking the medical profession in Nigeria at large.
We talk about Japa and Jakpada, and we've not been able to effect Jakpada in terms of getting the diasporians back.
The Elders Forum is put together by the Nigerian Medical Association, Lagos State Chapter, as a way to appreciate and show concern to those who have served the country through the health sector.
Professor Feni Adenowo, consultant rheumatologist LASO, and the Vice Chairman NMA 1983 to 1985.
Abiola, Executive Secretary of Family.
I am Dr. Wester of the CMD of IFBF Hospital, Maryland. Also the first zonal chairperson in AMP.
My name is Bakri Hamzat, internal auditor NMA Lagos.
With past and present medical directors and head of various health organizations seated, the chief host, Professor Akin Abayomi, who also represented the governor of Lagos State, Mr. Babajide Sanwo-Olu, was quick to remind all the task ahead.
It is no longer business as usual for us to meet the target of universal healthcare coverage and to meet the ambitious key performance indicators that have been set for us in our 30-year development plan, the LSTP. It's going to require almost some magical, off-target, revolutionary thinking. And I think that is why the NMA have brought you here this evening. Considering that times are changing, what is it that we must do to bring Nigeria back to where it was in the times when many of you were practicing in our glorified medical schools that were respected all over the world, and now we're struggling because of JAPA, because of collapsing financial power. But let us remember that we are the custodians of universal healthcare coverage. And in addition, we've been tasked with making Lagos State the model megacity of sub-Saharan Africa.
Keynote speaker is in here. That's the former Commissioner for Health, Lagos State, Dr. Leke Pito. Is being ably represented by the former...
The keynote speaker, Dr. Leke Piton, highlights the need for measures to be put in place to act the health reforms blueprint of the Lagos State government. While speaking on the theme Physician Involvement in Politics, Navigating the Intersection of Medicine and Politics, Dr. Mrs. Fumilayo Latunji, who represented the speaker, charged health practitioners to be involved in the decision-making of every level of government to save the face of the sector.
Medical doctors, as we all are aware, are not trained to handle politics, as this is not included in their training curriculum. However, it slowly becomes apparent that this crucial skill to interface with politics is required after graduation, as most times physicians are thrown into the challenging task of medical administration and advocacy, either as medical directors or chief medical directors of hospitals, permanent secretaries, honorable commissioners, or special advisors on health matters. I would like to state that the involvement of physicians in the above listed posts in politics differs to a great extent, and the use of personal knowledge, skill, experience, and intended goals usually come into play. It therefore must be noted that all tiers of headship within the health sector need to work together as a team to maximize achievements and outcomes.
Some of the high points of the gathering is the recognition of 3 senior citizens, which includes 2 non-Nigerians, as well as the launching of NMA Lagos Welfare Scheme.
Distinguished guest, Professor Oluwole Atoyebi.
Because I know what it takes to study to be a doctor. It's not an easy thing at all. but for you to train yourself to make sure your child, well, the child becomes a doctor also. And instead of the child helping the father and the mother, they would have to go over there. And I don't know what is so special about the place. I've been there several times, you know. But I mean, it hurts me that you educate your child and the child is not even there to comfort you and for you to feel happy that you have done something, you know.
The Lagos Commissioner for Health hereby assures Lagosians of the commitment of Governor Sanwo-Olu in the health sector.
Babajide Sanwo-Olu has decided that he's going to raise the standard of infrastructure. He's going to diversify the amount of medical specialist facilities. He's going to improve the welfare and the well-being of the professionals on ground. He's going to create an enabling environment for the private sector to flourish. That is the kind of environment we're looking forward to. And it's because of the conducive environment, the enabling environment, the ease of doing business with government and in state. We really want our doctors in the diaspora and our medical professionals, our nurses, to feel that it's time for them to come back with that wealth of experience that they've gathered for years and years and years of working in the other parts of the world. We don't want them to stay there. We want them to come home. Nigeria is their home.
It's important we start navigating things. You know, as the commissioner said, if you're not at the table, you can't impact the table. So for us, we must have doctors come into politics. For example, in the Lagos House of Assembly this year, there are no medical doctors there, and you now have you have people that are not medical practitioners helping us make policies for healthcare. I think the doctors should be deliberate about it and should be involved in policy making, in governance, and in politics. So this is just to give us a stimulant and an idea to push us to start doing these things as a function of policy and impact in our community.
The chairman of NMA Elders Forum, Major General Dr. Shino Ogunbiyi, retired, emphasized the importance and benefits of such forum.
And judging from the attendance, you can see a lot of retired doctors, both males and females, who are here, and they are able to integrate themselves, remember old times, network together. And with the launching of the NMA Lagos scheme, welfare scheme, which we believe is going to be an all-encompassing thing. We are starting with a pilot project with the elders first, and I'm sure you heard some donations that have been made, both not necessarily in terms of cash, but in terms of skills for elders of the profession. And for us, this indeed is a monumental achievement for this NMA Lagos executive at this time.
Very happy that the tradition is being maintained and sustained. It's very good for us to recognize our elders and all their contribution to the medical profession. We cannot do without their wisdom. They were there before us, even though the times are different, a little bit of technology here and there, but definitely their guidance and their wisdom is always what we cannot do without. And an evening like this with them will give us the ambience to be able to tap into their wealth of experience.
The Nigerian Medical Association hopes that its active involvement in politics and governance will positively influence health policy formulations across the country.